recording this from my living room because we are indeed honoring the MCO or the PKP. Today, there's a big news coming in from the government because of the 10 billion ringgit further stimulus plan package that was being introduced by the Prime Minister. It's also important to note that the item has been discussed at length on Consider This, the show preceding this particular one. So today we shall discuss a little bit more about some ongoings with the COVID-19, predominantly on the issue of the joint trial session that is currently being done by the World Health Organization and that of the Malaysian authorities, largely known as the Solidarity Trial. And in the Solidarity Trial, we're looking at Malaysia being one of the first few countries around the world that is currently being used and tested to trial drugs that are being used to treat COVID-19. What does this mean for the Malaysian healthcare system, and how does the data that is being used and collected in the Malaysian healthcare system be used for further studies and further developments in and around the globe? So joining me is Dr. Khor Swee Kheng here talking about the item. Doctor, again, thanks very much for spending the time with us. Let's understand a little bit better about the Solidarity Trial and what it means for the Malaysian healthcare.
Ibrahim, the World Health Organization Solidarity Trial is actually a successful achievement for Malaysia for several reasons. Firstly, this is a confirmation that Malaysia has the clinical research successfully run this trial in multiple hospitals in Malaysia. So it's not just concentrated, for example, in Klang Valley hospitals, but such expertise for clinical research is up north, all the way from Arau to Alor to Penang to the Sungai Buloh Kuala Lumpur General Hospitals of Malaysia, all the way to Sarawak as well. So this is really a testament to the infrastructure that Malaysia has put behind in clinical research over the last several years. So this is a good vindication of our efforts. The second one is that Malaysia should feel proud that we are part of a global initiative to combat this disease. This is why it's called the Solidarity Trial. The Solidarity Trial has got multiple arms, and the arms of the Solidarity Trial allow you to examine 4 different treatment modalities or treatment pathways all at once. So I think there's a benefit for Malaysia so that we can see the clinical trial results in a Malaysian population, which could be subtly different from a European population or a South American population or an African population for very slight genetic differences. So the presence of these 4 arms, shall we say, in a Solidarity Trial will allow Malaysia's, say, biological characteristics of the Asian heritage that we have to be properly put into the World Health Organization's mechanisms to make a decision about which medicine is the right one for us. And finally, the good advantage for us in having this trial is that we develop familiarity with each of these 4 treatment arms, so that whatever treatment arm has been proven to be successful in future, we will be able to very quickly implement them. So there are 3 good reasons why this trial should be welcome for Malaysia, Ibrahim. The first one being that Malaysia's clinical trial setup is rated world-class, and that's why we're one of several countries. Secondly, this allows us to, say, put in the biological characteristics in our part of the world and our heritage into the data of a pool of data that we have. And thirdly, our clinicians will gain expertise and experience in using the treatment modalities or the 4 treatment pathways that are inside the Solidarity Trial.
Further along in the study, we saw that the Director General of Health, Dr. Nur Hisham, earlier today at around 5:30 p.m. or around 6 p.m., he held that press conference. And in that press conference, he was talking about the #1 fuel for allowing COVID-19 to continue to thrive. And that is, of course, crowd gathering. We know that Ramadan is around the corner. We know that Hari Raya and Shawwal is also bearing down upon us. What does this mean for Malaysia when it comes to crowd control and marrying that with the traditional custom of Ramadan and also Shawwal? Do you think Dr. Khor, you agree with the statement coming in from the Director General of Health. Also, what does this mean for Malaysians in terms of managing the healthcare situation in the country?
I agree to the statements made by the Director General of Health, Dr. Noor Hisham Abdullah, where he shares his concerns about the presence of large gatherings in Malaysia. It's been proven from countries like South Korea, Taiwan, China, and Singapore, which are the earliest hit countries for COVID-19, that there are three measures that work very well: social distancing, mass testing, and contact tracing. Alone, they will not be able to achieve anything, but in combination, they are powerful. Let's talk about social distancing or physical distancing, as some people have spoken about. The presence of religious entities in Malaysia and religious services and also cultural festivities indicate that this outbreak cannot only be a medical or epidemiological or public health phenomenon, but we must also consider that this outbreak has got cultural, sociological, anthropological, and religious connotations as well. That is why we need an all of society response. From a pure public health perspective, mass gatherings are dangerous for several reasons. Number one, they are dangerous because many people will congregate in a very small space and therefore increases the risk of this disease to be transmitted. Number two, if many people congregate all at once and then they go back to wherever they came from, this means that they are also risking the spread of the infection. And number three, if many people were to congregate and then leave to their respective, say, hometowns, shall we say, contact tracing becomes even more difficult. These are the three reasons why mass gatherings are very dangerous during a COVID situation from a public health perspective. But let's consider then, Ibrahim, how we can address this, especially during the upcoming Ramadan and Shawwal festivals. We have to be careful because public health is important. We must also be sensitive to the needs of the community. Ramadan is a profoundly important spiritual and religious experience for many people. But certainly there are ways that we can consider the spirit of Ramadan, the spirit of community, the spirit of caring for somebody else, especially people who are less fortunate, the spirit of family and sacrifice. And one can even say that these kind of very beautiful spirits of Ramadan could and can and must and should perhaps coexist with the spirit of movement control orders, because every religion wants us to take care of ourselves and our health, and also to take care of the health of other people. The sensitivity surrounding religion, I think, Ibrahim, makes it very necessary for the ministries of health to talk to the state muftis and the Islamic religious authorities, and indeed religious authorities of many other religions, so that we can achieve a good consensus about how we can manage the religious and cultural sensitivities, but at the same time respect the public health implications of mass gatherings. Ibrahim, I feel certain that Malaysia can get through this only if we talk to each other respectfully and not get into our silos, because we need everybody to talk to each other so that we can get through the next period of MCOs safely for all Malaysians.
That was Dr. Khor Swee Kheng calling in from his living room, largely because he is also under quarantine. If you've missed any part of this interview, just head on to AstroAwani.com, look for Notepad over there. I urge you to also search for Consider This. There are plenty of good interviews that are currently being done by my colleagues, Melissa Idris and Sharat Kutan, along with our joint producer, Hafiz Marzuki, in churning out one of the best procedures and one of the best episodes that we bring for you under this very trying times. Again, that's all from me for this particular episode. Thanks very much for watching, and goodbye.